Hello and welcome to UK Fitness Hub. My name's Travis Tarrant, and in today's video we're going to be looking at the QL muscle, the Quadratus Lumborum. We're going to be going through where it is in the body, what it does and how to stretch it out. Let's get into it. So before we get to stretching out the QL muscle, it's really important that we know where it is. So when we get to stretching it, we know that we're stretching the right place. So it starts from three places. And the three places are the posterior border of the iliac crest, the transverse process of L5, so lumbar vertebrae 5, and then it also originates from the iliolumbar ligament, which goes where my index finger is going to L5, and L4. So that's where it starts. So where does it finish? It finishes at the medial border of the 12th rib, and it also goes to L1, L2, L3, and L4. So let's talk a little bit about what that would look like. So I've got my band here, and it would attach to the ribs, like so, transverse processes, like so. And then L5 would go up and join in that part as well. So I'll put a picture up now so you can see what this would look like on a diagram. But ultimately the muscle is spanning up to the 12th rib and going to L1, 2, 3 and 4. L5 is where it starts, as well as the iliac crest. So why is the QL muscle important, and what responsibility does it have when it comes to the body? So the first one we're going to talk about is it's responsible for lateral stability and helping us and assisting us in side flexion. So side flexion is simply bending from side to side, so it assists in that movement. If I take you back to earlier when we spoke about the insertion points, we spoke about the QL muscle inserting onto the medial border of the 12th rib. And this is important because the QL also helps with diaphragm stabilization, so an important muscle for singers, for example. Then we spoke about it also inserting onto L1 to L4 at the transverse processes. And that's important because it helps to extend the lumbar spine, one of the many muscles allowing us to be able to stand up straight. If we think about when this would be used in sport, for example, let's take a boxer. If they're blocking a shot and they're side flexing, they're working their QL muscles. So let's take a practical example. Because we've got a QL on both sides, if I was to side flex to my left, I've lengthened my right QL and I've shortened my left QL. I've shortened my left QL because I've brought the space between my ribs and my pelvis to a shorter degree. So that's a good way to remember it. Finally, if we think about the muscle getting chronically tight, that could cause the body to have referred pain in the hips, the glutes, and also the lower back. Let's get into some stretches that we can do for the QL if it is tight.
The first stretch we're going to cover is gate pose. Start off in a kneeling position and extend one leg out to the side with your toes facing forwards. Once in this position, extend the opposite arm up of your outstretched leg, then begin to side bend towards your outstretched leg. You can run your free hand down the stretched leg for a deeper stretch. If you find kneeling uncomfortable, you can use a mat like I am, or even a soft cushion underneath the knee for added comfort. I want you to stretch out both sides for 2 sets of 30 seconds on all the stretches covered, even if you're just injured on one side. This is because we often compensate with our good side when injured. The next stretch is a side lying QL stretch. Start off lying on your side with your legs straight and then swap the natural position of your feet over. Next, I want you to raise up your upper body by going onto your elbow, keeping your hips firmly on the ground as you do so. If in this position you feel a deep stretch, keep it there. However, if you don't feel a stretch or it's too light, you can begin to raise up onto an extended arm for the deeper stretch variation. Remember, this isn't a side plank, and in both variations, we keep the hips down. Do this for 2 sets of 30 seconds on each side. For the final stretch, start off in a kneeling position and bring one leg in front of your body and bend your knee to make a right angle. Then, with the other leg, bring it behind your body to also make a right angle at the knee. If you have your right leg in front of you, I want you to extend your arm overhead and side bend to the left-hand side. If you have your left leg in front of you, begin to side bend to the right-hand side. With your free hand, have it in contact with the floor for balance. Try to get the most out of the stretch by not only side bending, but also rotating slightly as well. You'll notice here, I'm stretching slightly diagonally due to the rotation. Once in this position, you can also push your foot back away from your body to really open up the hip joint. If you have a chronically tight QL and stretches aren't quite doing it for you, you can try a QL mobilization. I'm using a 2 kg dumbbell here, but you can use a spiky massage ball or lacrosse ball to the same effect. Lay on your side and place the object you've chosen underneath the sore QL. Bring your top leg into a bent position at the knee, and with the leg closest to the floor, you want to begin to slowly raise the knee towards your body and then back to a straight leg position. As you do this, you should feel the muscle contract and relax against the object you have on your QL. This is called flossing, and it can be an effective technique to deeply get into trigger points. Do 10 repetitions on each side, then rest for a few minutes before repeating for one further set.
The QL can get tight for many different reasons. It could be overuse, straining or poor posture. Sometimes when people get QL tightness on one side rather than the other, it could be uneven hip position or somebody with one leg that's maybe a little bit longer than the other. That's quite a common one. If we think about when the QL both fire together, they both fire at the same time under extension of the back. So if somebody was presenting chronic QL tightness, it does depend on the person, but one of the first things that I would check is, are their glutes firing? Are the hip muscles doing what they're supposed to do? Is that them putting lots of pressure onto the QL, forcing them to constantly contract? So it might be something to look into if you've got chronically tight QL muscles. Are the glutes and hips doing their job, allowing the pelvis to be stabilized, taking the pressure off the lower back? That concludes the end of today's video. Thank you very much for making it this far and watching. And if you have learned something new, please leave a like on the video and subscribe for more free educational content. My name's Travis Tarrant, and you've been watching UK Fitness Hub. I'll see you soon.